Hello everyone and welcome to another audio podcast in this series, the Excerpts Equipoise chapter. This is the Shientist, and this is another Storm Robotics production. Today I'm going to provide an excerpt around the correlation of polypharmacy and its effect on renal insufficiency in CKD patients, and this is an excerpt that provides a context around compare and contrast investigations. So the excerpt around this is that in context of the introduction, polypharmacy and use of multiple medications has become a public health issue, and it is associated with increased risk of hospitalization, adverse drug reactions, reduced medication adherence, increased healthcare costs, and reduced functional ability. There is an increasing risk of adverse effects across population health. Polypharmacy can enhance the risk of kidney insufficiency, potentially due to several pharmacological metabolites impact on renal physiology, health and metabolism. The aims around this work was the research looked to examine the correlation of polypharmacy on renal function in suspect or high-risk patients. The objectives around this was to compare and contrast literature assessing correlation and effects of polypharmacy on renal function. The design and methodology around this included renal dysfunction, incidence of polypharmacy in suspect and high-risk patients versus control groups. Data would be analyzed using descriptive analysis, and renal epidemiology or registry data will be utilized to understand what improvements can be made relating nephrology. The discussion around this context is that polypharmacy has a complex interaction against aspects of health, depending on the nature of renal impairment. Although multiple medication use is and can be clinically appropriate, it is essential to identify patients with inappropriate polypharmacy that could place patients at increased risk of adverse effects on renal insufficiency. The conclusion around this is that several studies have indicated that polypharmacy is associated with acute kidney injury, AKI, and there is a correlation between polypharmacy on renal impairment. This research highlights what can be done to preclude a long-term health detriment to patient care. The main terminologies around this work include polypharmacy, biochemistry, descriptive statistics, and nephrotoxicity. In context of the acknowledgements, I'd like to acknowledge Barakat, wherein there was a collaborative effort between an academic institution and the Renal Patient Support Group, the RPSG. Once again, this has been another Storm Robotics production. The excerpt around this again was the correlation of polypharmacy and its effect on renal insufficiency in CKD patients, and this was an excerpt that again looked at a compare and contrast investigations.